A special parliamentary committee on public sector and service delivery with the Department of Health has revealed that Papua New Guinea still lacks specialist doctors to treat patients diagnosed with cancer. Not only that, lack of proper equipment to detect and treat cancer has been a major concern over the years. Despite the Health Department's strategic plan to address the issue, little has been done. Many people have suffered or died from the disease over the years. Cancer is caused by excessive tobacco use and high consumption of alcohol. Lifestyle diseases caused by processed foods contribute to cancer being prevalent across the country. Cancer among women has caused many deaths. Cervical and breast cancer are common among many women in the country. Prostate cancer is common among the male population. The only cobalt machine in Ley City is currently non-operational. Adding to the problem is the absence of radiation oncologists. After 40 years, PNG still doesn't have a permanent radiation oncologist to treat patients. The Health Department has revealed that almost 10 years on and PNG still doesn't have one.
That's the time up to now. We haven't been able to get a radiation oncologist.
Dakulala said the Health Promotion Unit needs support from the government and stakeholders to create awareness and promote healthy lifestyles. Even the introduction of the HPV cancer vaccines was not effective, according to the Health Department. Funding constraints has been a major obstacle in carrying out the health promotion. Despite training of medical officers to take up the post, many left for greener pastures.
He said, we trained 2 people or 3 people. They failed on the way. We trained them over the last 30 years. They didn't progress, they failed. To put it bluntly, they failed. And our Dr. Niblet was the one who was helping them to the process. And so, because they failed, we don't have anyone on the ground. We don't have any local champions, put it that way.
Deputy Chairman of the Special Parliamentary Committee has questioned the Health Department of having an action plan. Mr. Jufa said the action plan would help the department to plan and improve on areas that's lacking. This would also help the government and important stakeholders to assist where necessary.
Well, I'm sure they can put aside some money and say, let's get 100 students, send them to Australia, America, wherever, train them up. Have a plan. In the next 10 years, they will start coming back.
Important stakeholders from private sectors have been working closely with the Health Department to find a best solution forward. During discussions, these important stakeholders were urged to help the government and the department to address the issue. One such organization is the Institute of Medical Research. According to IMR, PNG has the highest burden of cervical cancer compared to other countries around the world. IMR has been conducting various research on the prevention of the disease. It has come up with a highly advanced screening process to detect cervical cancer. However, the costs involved and its implementation in the long run is something the government and all concerned authorities need to work on.
And I think in that larger study, now we've demonstrated that this approach is, we're happy with the algorithm. We think this is the best, this is a good algorithm. We know we can detect disease early and treat. What we would like to do is look at the cost effectiveness of this approach. And we'd like to look at the issues around potential future implementation.
With the introduction of a new cancer vaccine last week, IMR is confident of building resilience in its research to find the best possible solutions towards eradicating cancer. The meeting also discussed both long and short-term recommendations. This will require a collaborative effort that would go a long way in preventing the disease and saving lives in the country.